Thank you for joining me today. In this video, we are going to learn more about lithium. What are the 25 things students must know before you pass the board? Lithium name is lithium carbonate. That is the genetic name. Brand name is lithium or lithiopide. It's mood stabilizer. Lithium is available immediate release or extended release format. Second thing, you want to know the indication of lithium. Lithium is primarily used bipolar disorder, acute mania, and mixed episode. Lithium is used maintenance of the bipolar and prevention of mania and depressive relapse. It's also used additive to other medication of antidepressant medication for the patient who have persistent treatment-resistant depression. Lithium treat mania, long-term maintenance, and treatment-resistant depression. Third thing that you want to know from lithium is lithium does not have one simple receptor mechanism. That is the mechanism. It affects intercellular signals and second messenger that include inhibition of the enzyme involved in inositol signal and modulator. When you think about lithium as a medication that modulates intercellular signals rather than simple block one neurotransmitter. The fourth thing that you want to know is that lithium has narrow-therapeutic-index. This is one of the most important concepts. The difference between effect concentration and toxicity concentration can be relatively small, and lithium requires therapeutic drug monitoring. The fifth thing that you want to know is that lithium requires baseline evaluation. Before initiating lithium, you want to evaluate kidney function, thyroid function, electrolytes, calcium, weight, body mass index, pregnancy, current medications, and potential drug-to-drug interaction. You want to remember lithium affected by the kidney function, thyroid, and calcium. The sixth thing that you want to know, you want to check the blood lithium concentration. Blood lithium concentration should be obtained using a consistent time, commonly approximately 12 hours after the previous dose, and when thorough concentration is intended. Levels are particularly important. After starting lithium, you want to check the level. After dose change, you want to check the level. When a toxicity is suspected, you want to check the lithium level. when medication compliance is uncertain, you want to also check the lithium level. If you suspect that the patient have not been taking the medication, you have to check the level. When you suspect interaction with other medication that can increase or decrease level of lithium, you can also assess the lithium level. When you want to stop medication sometimes you have to stop medication before you start lithium, you want to check the lithium. Also, there you can check the lithium level periodically during the maintenance. The seventh thing that you want to know from lithium is a therapeutic concentration. Common clinical targets are approximately acute mania. You wanted the therapeutic concentration to be 0.8 to 1.2. Maintenance, you wanted the therapeutic to be 0.6 to 1. Target should be individualized according to the response tolerance, age of the patient, comorbidity, for example, if they have a kidney disease or thyroid, and clinical circumstance. Acute mania generally require higher target that maintenance treatment requires. The eighth thing that you want to memorize and you want to know is the common adverse effect of lithium. Common lithium adverse effects include fine tremors, nausea, diarrhea, increased thirst, increased urination, weight gain, and fatigue. Important consideration is that fine tremor can occur at the therapeutic level. Do not automatically interpret every tremor as a toxicity. The ninth thing that you want to know from lithium is the lithium toxicity. This is the one of the highest yield for the exam. Early toxicity can include nausea, vomiting, diarrhea, worsening tremors, and weakness. More significant toxicity can cause coarse tremors, confusion, ataxia, slurred speech, sedation, markable sedation, muscle weakness. However, severe toxicity, lithium toxicity, can cause seizure, coma, cardiovascular instability, and that can lead to death. Coarse tremors, ataxia, confusion equal to lithium toxicity until prevented otherwise. The 10th thing that you want to know from lithium and you want to memorize is dehydration can cause lithium toxicity. Lithium is primarily eliminated through the kidney. Lithium is eliminated through the kidney. When the patient comes dehydrated, lithium clearance can decrease and the lithium blood concentration can rise. High risk situations include severe vomiting, diarrhea, heavy sweat, fever, poor oral intake, significant flu loss. You want to teach the patient to maintain hydration. The 11th thing that you want to know from lithium is sodium matter. Sodium and lithium handled by the kidney are closely related. The way the kidney monitor are related. Certain sodium depletion can increase the lithium retention. Therefore, patients should avoid a major interrupted changes in dietary sodium intake unless the medically directed. You want to remember low sodium leads to increased lithium retention, and that leads to lithium toxicity risk. The 12th thing that you want to know from lithium is NSAIDs medications. Many NSAID medications can increase lithium concentration. NSAID medication examples include aspirin, ibuprofen, naproxen. They increase lithium concentration. Patient taking lithium begins regular ibuprofen and develops tremor and GI symptoms. Think drug-to-drug interaction that can lead to lithium concentration, increased lithium concentration and possible lithium toxicity. Patients should check with their clinicians before regularly using any NSAID medications. You want to also remember diuretics. Thiazide diuretics. Thiazide diuretics can significantly increase lithium level. Lithium with thiazide can increase the lithium level. Also, ACE inhibitor medications for blood pressure can increase the lithium level and can lead to toxicity. Patient taking lithium who started ACE inhibitor may require close monitoring and possible lithium dose adjustment. Also, you want to know angiotensin-2 receptor blocker medications can increase the lithium level. So if the patient taking lithium with new blood pressure medication, that can lead to toxicity, lithium toxicity. Think about the medication that can cause lithium toxicity, such as thiazide diuretics, ACE inhibitor, angiotensin 2 receptor blocker medication, NSAID medications. These can increase lithium level and can lead to lithium toxicity. Kidney function, that is the 16 things. Number 16, kidney function is a crucial. Lithium primarily is eliminated through the kidney. Kidney function reduces lithium clearance, and that leads to lithium toxicity risk. So you want to monitor kidney function through the treatment. Lithium, if the kidney function is decreased and the patient is taking lithium, you want to reassess the lithium therapy and the concentration. You want to adjust the dosage. Lithium can affect the thyroid. Long-term lithium therapy can cause low thyroidism, hypothyroidism, or goiter. Changes in lithium function. You want to monitor lithium function periodically. Patient on long-term lithium who develops fatigue, weight gain, constipation, cold intolerance, you want to think about hypothyroidism, and you want to assess the lithium level, and you want to adjust the dose. Lithium can increase calcium. Number 18, lithium can increase calcium. Lithium can affect parathyroid function that can lead to hypoparathyroidism, and that increases calcium. Therefore, calcium should be assessed periodically. Patients taking lithium are repeatedly have elevated calcium. So lithium is associated with hypoparathyroidism. It affects the parahypothyroid. Number 19, lithium and pregnancy. Lithium can cross the placenta and is associated with fetal risk. However, bipolar disorder itself can carry substantial risk if adequate treatment is not done. Therefore, pregnancy decisions require individualized risk and benefit assessment rather than automatic discontinuation of the lithium. You want to assess the risk of the discontinue. If you want to discontinue lithium, if the mother been taking lithium and get pregnant, you have to weigh the risk of the fetus and the risk of the mother who is bipolar and is not taking her medication lithium. You have to assess that and weigh the risky benefit assessment. Number 20, lithium and breastfeeding. Lithium passes into the milk. Therefore, it should be continued during the breastfeeding and require individualized consideration that involves a severity of the mother illness, alternative treatment, if there is alternative treatment, and the infant risk factor, and you want to monitor the concentration for both the mother and the infant. Pregnancy and lactation questions require individualized risk-benefit assessment. Number 21. Maintenance maintain consistent fluid intake. Patients should maintain adequate and relatively consistent fluid intake. You want to teach the patient to continue or contact with the provider if they are having a diarrhea, vomiting, fever, heavy sweat, if they are having a poor oral intake of fluid. These situations can change the lithium concentration, so you want to teach the patient to contact with the provider if they feel these symptoms. Number 22. You want to educate the patient. You want to educate the patient about the taking lithium exactly as prescribed. You want to teach the patient to do not double if you miss a dose of lithium. You want to educate the patient to maintain constant fluid intake. You want to teach the patient avoid sudden major changes in dietary sodium. You want to teach the patient check before starting new medication. Check with the provider. Avoid regularly using NSAID without the medical guidelines. Avoid recommending obtain a recommended laboratory test, and you want to teach the patient to keep the appointment, follow-up appointment to check the lithium level. You want to teach the patient to report any symptoms of toxicity immediately. You want to teach the patient to recognize and monitor if they have a severe diarrhea, severe vomiting, worsening tremor, toxicity, ataxia, confusion, and you want to teach the patient to seek urgent medical care. Number 23, lithium and suicidal ideation. Lithium is particularly important because there is evidence supporting that suicidal prevention benefit in mood stabilizer. This is one of the reasons lithium remains the important long-term treatment options despite its monitoring requirements. If the question asks about the medication with evidence for reducing suicidal risk in bipolar, you want to think about lithium because the lithium reduces suicidal risk in bipolar patients. Number 24, do not stop lithium without plan. Stopping lithium suddenly can increase the risk of mood episode recurrence. When a clinician approves, lithium is greatly tapered rather than stopping quickly. If a significant toxicity occurs, do not continue lithium simply because it could normally be tapered. Toxicity requires Urgent clinical management. Number 25. Know the classic lithium bore question. Patient with bipolar disorder has been taking lithium. The patient develops family, worsening course tremors, difficulty walking, slur speech, and confusion. What is the most likely explanation? The answer should be lithium toxicity. The clinician should recognize this as a potential serious adverse reaction and withhold further lithium pending urgent clinical evaluation that include assessment of the lithium level concentration, kidney function, electrolytes, dehydration status, and severe toxicity. The 10 lithium facts that you want to memorize include: lithium treat bipolar mania, lithium treat bipolar maintenance. Lithium is indicated for bipolar mania and maintenance. Lithium has a narrow-therapeutic-index that needs to be monitored the concentration. Lithium needs kidney function, thyroid function assessment. When the patient is taking lithium, you have to assess the calcium level and parathyroid function. Avoid taking medications that interact and increase lithium. Fine tremors are common side effects. However, course worsening tremors with ataxia and confusion is a lithium toxicity. You want to remember lithium as a memory take of lithium. You want to assess the lithium level. I is you want to assess the interaction medications. T is that you want to check the thyroid function. H, you want to assess the hydration. I, you want to also assess the sodium intake. U, you want to assess the urinary kidney and the kidney function, urine and kidney function. M is you want to monitor calcium level. Thank you for joining me today. I would love to see you in my next video. Thank you.